Sarah Saville, a falls practitioner, and I'm a physiotherapist.
My name is Claire Asakumaran and I'm a falls practitioner. I'm a nurse.
We both work for the Falls Community Service for Locala. We see people in their own homes or a care home setting, and we also see people in the Falls Clinic based at Acre Mills. So why are we here talking about falls? Why are falls so topical? Did you know that the number of people in society is set to rise dramatically due to the ageing population? And we know falls account for half of all hospital admissions. Falls account for 40% of all ambulance call-outs. Within Kirklees, approximately 25,000 people aged 65 plus fall every year. That is only the ones that we get to hear about. Some people don't like to admit to having a fall as they are fearful of going into hospital or having increased care. This can lead to a downward spiral for the individual of reduced mobility, reduced confidence, which in turn can lead to increased dependency and social isolation. And also, some people don't admit to falling if they have not hurt themselves.
So let's dispel some myths. Falls are not a normal part of ageing and there may be something that can be done. We divide the reasons for falls into 3 different categories: intrinsic, extrinsic and behavioural. Intrinsic falls are person-related from within. So this could be somebody who's prescribed a lot of medication or has difficulty with their cognition. Extrinsic falls are more environmentally related. So for example, footwear, uneven pavements, clutter, rugs and poor lighting. And behavioural falls are where people continue to take risks when they're perhaps unable to do so. For example, forgetting to use a walking aid or climbing up onto a chair to change a light bulb. Now, clearly, we can't change our biological age, but by understanding what puts us at risk, we can help to make preventative action. So we've got a checklist for you to see if you're at risk of falls. Perhaps you've fallen and you've not seen anybody about it. Perhaps you've got a lot of medication, 4 or more prescribed medication, and this might not have been reviewed in the past year. Do you often get up to use the toilet during the night and perhaps you forget to turn on the lights, put your slippers on and put your glasses on? Are you not as active as you used to be? Do you sometimes feel dizzy or lightheaded on standing or walking? And do you struggle with basic maintenance in your home? You may have a bit of clutter that has built up in your home over the years. Do you drink enough fluids? Because we recommend that you drink 6 to 8 cups every day. Are you controlling your alcohol intake? And are you struggling to take good care of your feet? And finally, do you have a long-term condition such as Parkinson's disease, heart disease, stroke, dementia or diabetes? Those are some of the falls risks. It's only cartoon characters who slip on banana skins. The risk is rather obvious to the rest of us. But how many other common slipping, tripping risks do you ignore? Here are our top 5. Poorly fitting shoes, trailing clothes, shuffling when you're walking, worn out slippers, and walking in socks and tights on hard floors. We also have some tips to fall-proof your home because 6 out of 10 falls happen in the home or the garden. And not surprisingly, as we get older, so do our homes. They get old too. Carpets get worn and clutter builds up and we may not be able to stay on top of maintenance as we used to do. So in the living area, you could check that rugs have a non-slip underlay and consider replacing frayed carpets. We recently saw a lady who wall-mounted her rug in order to prevent a trip hazard. Cable tidies or boxes will organise jumbled wires, and perhaps you could tape trailing extension leads onto skirting boards. Remember to clear away clutter, especially on the staircases, and try not to store items of belongings on the stairs. A surprising number of people can trip over their pets, so it may be worth buying a bright coloured collar or a bell to alert you of their presence. In the kitchen, you can clear up spills straight away and consider installing grab rails. Are you continuously reaching for things? You may be able to try and rearrange your cupboards with frequently used items so that they're within reach. In the garden, try and keep paths free from moss and leaves, and repair any cracks in the paving stones, and consider installing safety rails. Also, you can ensure that your back and front doors are well lit.
Keeping moving for a balanced life. We have seen how ageing impairs balance, muscles and joints. This could be worsened if we spend long periods sitting down. The more active you can be and the more you break up your day so you're not sitting for extended periods, the more you can offset the effects of ageing. Here are some ideas of things you can do to stay active and maintaining balance and mobility. When watching the TV, roll your shoulders regularly and get up and walk about in every ad break or between programmes. Gardening and housework and walking to the shops rather than driving or getting the bus. Strengthening and balance fitness classes. Yoga, it's never too late to learn. And Tai Chi, the slow, gentle movements are proven to improve balance in older adults. And when sitting, keep your back up straight as possible to avoid developing a stooped posture, the enemy of good balance. Some people get so worried about falls that they restrict their movement and spend long periods sitting down. This harms balance, body, strength and mobility, which in turn makes a fall even more likely. It's a vicious circle that damages confidence and independence. If this is you, set yourself small, gradual goals. Enlist your friends or relatives to help stay positive and practice relaxation exercises for anxious moments. Getting up from a fall. If you should fall, lie still for a minute. Stay calm and check yourself for any injuries. If you are unhurt and think you can get up, there are steps you can follow to help you get up. Step 1. Roll onto your side, then push up onto your elbows. Step 2. Use your arms to push yourself onto your hands and knees. Step 3. Crawl to a very stable piece of furniture, for example, a sturdy chair or a bed, and hold onto it for support. Step 4. Slide or raise the foot of your stronger leg forwards so it's flat on the floor. Step 5. Lean forwards and push up using your arms and front leg, slowly rising to a standing position. And step 6. Turn around and sit down, and just sit for a minute or two and rest. Another tip if you can't get onto all fours is that you can bottom shuffle or roll to a lower surface like the bottom stair or a sofa. Sit with your back to it, put your arms behind you onto the surface and push up with your hands and feet, lifting your bottom onto the surface. If using the stairs, go up to the next step before standing up. If you know you can't get up or feel pain in your hips or back if you move, follow these next steps and they will be a lot easier if you have already done a bit of forward planning. To get help, you can use your pendant alarm if you have one, or call nearby neighbours on your phone. Put them on speed dial now. Use your phone to call 999. Bang on the wall or radiator or floor. Make sure you stay warm. Cover yourself with anything you can find, a tablecloth, a blanket, a rug or a coat. And put a cushion under your head or roll up an item of clothing. And keep moving. Roll from side to side and move your limbs as pain allows to help keep you warm and maintain circulation.
Planning ahead. It makes sense to prepare yourself and your home just in case you do have a fall where you are unable to get up off the floor. Then you can get on with enjoying your life, knowing that you've done the groundwork. So make sure you follow the tips that we mentioned earlier on how to fall-proof your home. As Sarah said, place cushions and blankets around the house at floor level so that if you do fall, you can keep warm and comfortable whilst you're waiting for help. You could also put a bottle of water with the cushions so that you can stay hydrated whilst you're waiting. If you have a cordless landline phone, remember to carry it around in your pocket. And if you don't already have a mobile phone, buy a mobile phone and keep it with you switched on in your pocket or your belt. And remember to program the phone numbers of your neighbours and friends nearby who could help you if you have a fall. You could also consider getting a community alarm and wearing a pendant or a wrist alarm that you can press a button to the control centre that will telephone your nominated key holder so that they can check on you. If you would like to speak to a healthcare professional if you have any concerns regarding falls, you can contact Locala's single point of contact on 0300 304 5555, or you could contact Gateway to Care for a care phone on 01484 414 933. By taking these positive steps to prevent falls, you can preserve your health and independence for a little bit longer.